It usually strikes when you're most vulnerable, deep in sleep or just after you've settled into your favorite chair. A sudden jolt, your muscles clench, the pain grips like a fist, and for that brief moment, everything else disappears. If you're over 60, this might be more than familiar. It might be your nightly visitor. As we age, our bodies whisper things we once ignored. A little stiffness in the morning, a leg that twitches in the dark, a calf that tightens like it's trying to speak a forgotten language. For many older adults, muscle cramps are no longer rare. They're frequent, disruptive, even frightening, and yet cramps are often brushed off as part of getting older. But what if they're not just a symptom, but a signal? In this video, we won't just talk about cramps. We'll explore why they happen more often as we age, and more importantly, how to gently and effectively prevent them. Through simple, science-backed steps, we'll walk together into a life with fewer interruptions, less pain, and deeper sleep. Because the quiet hours of the night should belong to rest, not to pain. Overview. The 5 tips to prevent cramps in older adults. Part 1. Stay gently hydrated. Throughout the day, hydration is one of the most underestimated pillars of good health in older adults, especially when it comes to preventing cramps. As we age, our sense of thirst naturally diminishes. This means that by the time we feel thirsty, we may already be mildly dehydrated. This subtle dehydration can quietly affect how our muscles function, how our nerves fire, and how well our body regulates essential minerals like sodium, potassium, calcium, and magnesium, all of which play a vital role in preventing muscle cramps. Muscles are like engines, and like any engine, they need fluid to keep from overheating, seizing up, or misfiring. Without enough water in the system, the delicate balance of electrolytes inside and around our muscle cells becomes disrupted. Even a slight shift can cause muscles to contract involuntarily, leading to cramps that range from uncomfortable to excruciating. But staying hydrated doesn't mean simply drinking a large glass of water all at once. In fact, doing so occasionally may not be very effective. The key is gentle, consistent hydration. Small sips throughout the day, tailored to your body's needs and activity level. A good habit is to drink a half glass of water upon waking, a full glass mid-morning, another with lunch, one mid-afternoon, and a final glass with dinner. In the evening, especially for those who are sensitive to nighttime urination, even a few sips may be enough to maintain hydration without disrupting sleep. Some older adults avoid water in the evening out of fear of nocturia, waking up at night, to urinate. While this concern is valid, it's important not to fall into the habit of dehydration. Instead, consider spacing out water intake earlier in the day and reducing fluids after 7 p.m., while still ensuring total hydration across the day. Balanced hydration helps muscles remain supple, nerves conduct properly, and cramps become far less likely. Additionally, it's worth noting that not all fluids are equal. Caffeinated drinks, such as coffee and some teas, may act as diuretics in larger amounts, leading to fluid loss. Alcohol too can contribute to dehydration. The best fluids for hydration are plain water, herbal teas, and in some cases, electrolyte-balanced beverages, particularly after sweating or taking medications that increase fluid loss, such as diuretics. Lastly, don't rely solely on thirst as a signal. A dry mouth, darker colored urine, or a sudden feeling of fatigue may all be earlier signs that your body needs water. Being proactive rather than reactive is the key. In short, gentle, steady hydration supports muscle balance, prevents cramping, and nourishes the body's aging systems. Like watering a garden, a little at a time, regularly, is far better than a flood once in a while. Part 2. Replenish magnesium and potassium. Naturally, when we speak about muscle cramps, we are often pointing towards something deeper, a quiet imbalance within the body's internal chemistry, particularly in its mineral system. 2 of the most critical minerals involved in muscle health are magnesium and potassium. Their role in cramp prevention is not only essential, but often under-recognized. Let us begin with magnesium. Magnesium is involved in over 300 enzymatic reactions in the human body. Among its many functions, one of the most crucial is helping muscles relax after they contract. Without enough magnesium, muscles can become overly excitable, contracting unexpectedly and sometimes violently in the form of a cramp. This is particularly relevant for older adults, whose absorption of magnesium from food naturally decreases with age, while loss of magnesium through urine may increase, especially in those taking diuretics or certain medications for blood pressure, heart conditions, or diabetes. Magnesium is not stored in large reserves in the body. It must be replenished consistently, ideally through natural sources in the diet. Some of the richest sources include leafy green vegetables like spinach and Swiss chard nuts and seeds, especially pumpkin seeds and almonds, whole grains such as brown rice, quinoa and oats, legumes like black beans and lentils, avocados and bananas, dark chocolate in moderation. One important note: while magnesium supplements are widely available, self-prescribing them can sometimes lead to side effects like diarrhea or interfere with medications. It's always best to consult a doctor or dietitian before using over-the-counter supplements, particularly if you have kidney issues or take medications for heart rhythm or blood pressure. Now, let's turn to potassium. Potassium works in close harmony with sodium to maintain the body's fluid balance and electrical activity, especially in nerve and muscle cells. Low potassium, known medically as hypokalemia, can result in muscle weakness, fatigue, and frequent cramping. This condition becomes more likely in older adults due to several factors: reduced appetite, diuretic use, certain blood pressure medications, vomiting, or prolonged sweating during warm weather. Fortunately, potassium is found abundantly in many whole foods. The most effective sources include bananas, widely known but not the highest source, sweet potatoes and white potatoes, especially with the skin on, beans, white beans, kidney beans and soybeans, leafy greens, spinach, kale, dried fruits like apricots, and raisins, oranges, and orange juice, yogurt, and milk. For individuals with healthy kidneys and no restrictions on potassium intake, incorporating these foods into daily meals can gently raise potassium levels and improve muscle function over time. However, people with chronic kidney disease or those taking medications that retain potassium should avoid excessive intake without medical guidance, as too much potassium can also be dangerous. It's worth emphasizing, both magnesium and potassium work best in balance, and neither functions well in isolation. They need a supportive dietary environment, one that includes plenty of hydration, as discussed in Part 1, healthy fats to help absorption, and consistent intake, not random bursts. Moreover, both minerals depend on gut health for proper absorption. Chronic digestive issues such as gastritis, IBS, or long-term use of acid-reducing medications may impair the body's ability to absorb these minerals effectively. In such cases, it's wise to speak with a healthcare provider about both diet and possible supplementation. In conclusion, replenishing magnesium and potassium is not about sudden fixes or pills, but about steady, natural restoration. By making mindful choices in your meals each day, you create an environment within your body that supports calm, balanced muscle activity. And in doing so, you take a powerful step toward reducing the frequency and intensity of cramps without harsh interventions. Part 3. Stretch with purpose. Especially before bed, stretching may seem like a small act, even an optional one. Yet for older adults who struggle with nighttime cramps or morning stiffness, purposeful stretching can offer one of the most effective and drug-free ways to prevent muscle spasms. The human body is designed for movement. Muscles were not meant to stay idle for long periods. But as we age, physical activity often declines, sometimes due to pain, sometimes from caution, and sometimes simply from lifestyle changes. Over time, this reduced movement leads to shorter, tighter muscles, decreased circulation, and less efficient muscle-nervous system communication. All of these factors increase the risk of involuntary contractions, commonly known as cramps. What stretching offers is not just flexibility. It offers a reset. It gently coaxes muscles to return to their natural resting length. It improves blood flow, enhances oxygen delivery, and prepares both the muscle and the nervous system to release tension instead of locking into it. But not all stretching is the same. Many people stretch sporadically with little awareness or structure. They may tug at a calf once in a while or twist their back before standing up. While these are not harmful, they are often insufficient for real prevention. What the aging body needs is targeted, intentional, and consistent stretching, especially before sleep, when nighttime cramps are most common. Here's why bedtime is ideal. During sleep, circulation slows, muscles cool, the body is in a horizontal position, which can sometimes allow fluids to shift, affecting pressure around nerves and tissues. If muscles are already tight or fatigued, these changes can trigger cramps. A short mindful stretching session before bed helps undo the day's accumulated tension and prepares muscles to remain soft and uncontracted through the night. Key muscle groups to focus on include calves. Tight calves are a major source of leg cramps. Use a wall or stair stretch to gently lengthen the Achilles tendon and gastrocnemius muscle. Hamstrings. These run along the back of the thigh and are often shortened from prolonged sitting. Gentle seated or lying hamstring stretches can release tension. Quadriceps, the front thigh muscles, especially tight in those who walk or stand often. A standing quad stretch with support can improve balance and muscle health. Feet and toes. Simple toe flexing and ankle rolls help stimulate circulation in the smaller muscle groups. Lower back and hips, gentle trunk rotations and knee-to-chest stretches can loosen deeper core muscles that often affect leg nerve pathways. Each stretch should be held for 20 to 30 seconds, repeated twice per side, and performed slowly, never bounced. The goal is not to push into pain, but to invite release. You should feel a steady tension, not strain. It's also wise to pair stretching with deep, steady breathing. This activates the parasympathetic nervous system, your body's natural rest and repair mode, which supports muscle relaxation and mental calmness. For those with mobility limitations or balance concerns, chair-based or bed-assisted stretches are excellent options. There's no need to be on the floor or perform complex movements. Even gentle foot flexions, ankle rotations, and slow leg lifts done while sitting can help dramatically reduce cramp frequency. Importantly, consistency matters more than intensity. Stretching once a week won't do much, but 5 to 10 minutes every night before bed, that can transform your muscles' baseline condition, gradually restoring elasticity and reducing spasms over time. Finally, remember, the body responds best to signals it hears regularly. Just like brushing your teeth each night helps prevent cavities, stretching nightly helps prevent cramps. It's a quiet act of self-care, done not in a rush, but with intention. Sound gentleness and offering of stillness before sleep. Part 4. Keep warm. Avoid cold drafts on muscles. At night, muscles are living tissues. They respond not only to how we move or what we eat, but also to the temperature around us. In older adults, this sensitivity becomes more pronounced. What may have been a minor chill in youth can, over time, become the quiet trigger for tightness, spasms, and cramps. Cold is constrictive by nature. It narrows blood vessels, slows circulation, and causes muscles to become more rigid and reactive. For those over the age of 60, whose muscles may already be less pliable, exposure to even mild cold, especially during rest, can be enough to provoke an involuntary contraction. This is particularly important during the nighttime hours, when body temperature naturally drops. For many people, the cold of the room, a fan blowing on the legs, or sleeping with bare feet under thin sheets can result in localized cooling of muscle groups. Calf muscles, thighs, feet, and lower back are especially vulnerable. And when these muscles contract in the dark, the result is often a cramp that startles the body awake in pain. The solution is not complicated, but it must be intentional. Keeping muscles gently warm during rest is a form of passive therapy. It doesn't require effort, but it offers real protection. Consider the following simple yet powerful steps. Socks in bed. This may seem small, but warm feet support better blood flow and reduce nighttime calf cramps. Choose breathable, non-constrictive socks made of natural fibers like cotton or wool. Layered bedding. Use layers that can be added or removed easily as the night progresses. Light quilts or fleece blankets can insulate effectively without overheating the entire body. Avoid direct airflow. Fans and air conditioners that blow directly on the legs, feet, or back can silently cool muscle groups and cause localized tension. Redirecting airflow away from the body or turning it off during sleep can prevent this. Heated pads or warm water bottles. For those with chronically cold limbs, a warm, not hot heating pad placed over tight muscles for 15 to 20 minutes before bed can relax tissue and improve blood circulation. Always use caution and avoid sleeping with a hot device turned on, unless it has an automatic shutoff and is designed for overnight use. Warm baths in the evening. A 15-minute soak in warm water can do more than relax the mind. It softens muscle tension throughout the body and prepares it for restful sleep. Adding magnesium-rich Epsom salts may further enhance this effect. Keep legs covered. Even in warmer seasons, light pajama pants or a thin sheet over the legs helps reduce rapid cooling from temperature drops at night. Additionally, it's important to recognize that as we age, our body's internal thermostat becomes less responsive. You may not feel cold in the same way you once did, yet your muscles still respond to the chill. This disconnect between sensation and muscle behavior is subtle but real. As a result, proactive warmth becomes even more valuable. There's also an emotional dimension to warmth. The feeling of being physically warm, wrapped in comfort, protected from the chill, sends signals of safety to the nervous system. This, in turn, promotes parasympathetic activity, the body's natural healing and resting state. And a body at ease is far less likely to cramp. In short, protecting the body from cold, especially during rest, is not about luxury. It's about preservation. It is a quiet form of prevention, achieved not through effort, but through thoughtful care. Keeping muscles warm helps maintain their flexibility, supports blood flow, and reduces reactive tightness. It is a small act with significant impact, especially for those who seek uninterrupted sleep, free from the sharp, sudden pain of cramps. Part 5. Review medications and circulation with your doctor. Muscle cramps in older adults are often influenced by more than just lifestyle or diet. Hidden beneath the surface are medical factors that can quietly undermine muscle health and increase cramp risk, particularly medications and circulation issues. As we age, it's common to take medications regularly for various chronic conditions such as high blood pressure, heart disease, arthritis, or diabetes. While these medications are essential for managing health, some of them have side effects that can affect muscle function or fluid balance. For example, diuretics, often prescribed to control blood pressure or reduce fluid buildup, cause the body to excrete more water and minerals like potassium and magnesium. This loss, if not carefully monitored and compensated for, can lead to mineral deficiencies and muscle cramps. Similarly, statins, medications used to lower cholesterol, are well known to cause muscle pain or weakness in some people. While this does not affect everyone, it's important to be aware of this possibility. Other medications that may contribute to cramping include beta blockers, steroids, and certain antidepressants. The interactions between drugs and muscle health can be complex, and what triggers cramps in one person may not in another. Equally important is the role of circulation. Good blood flow is the lifeline that delivers oxygen and nutrients to muscles while carrying away waste products. In older adults, conditions such as peripheral artery disease, varicose veins, or diabetes-related neuropathy can impair circulation. Poor circulation means muscles receive less oxygen and fewer minerals, becoming more prone to fatigue and cramping. Because these issues can be subtle, sometimes progressing slowly without obvious symptoms, the best approach is proactive. Regular medical checkups that include discussion of muscle cramps and related symptoms provide an opportunity to review all medications with your doctor. Ask whether any drugs might be contributing to your cramps and discuss whether blood tests to check electrolyte levels or kidney function might be helpful. Doctors can sometimes adjust medication dosages, suggest alternatives, or recommend supplements safely tailored to your health profile. They can also evaluate circulation through tests or refer you to specialists if needed. Additionally, Lifestyle changes such as gentle exercise, quitting smoking, or managing blood sugar levels may be advised to improve circulation, which in turn supports healthier muscles. Remember, muscle cramps are often a sign, your body's way of signaling imbalance. Partnering with your healthcare provider turns these signals into a plan of action that can reduce discomfort and improve your quality of life. Taking responsibility for your health means asking questions, sharing symptoms honestly, and working collaboratively to find solutions. It's a journey of care and understanding that supports both your body and peace of mind. Thank you for spending this time caring for your body and mind. Muscle cramps may seem like small discomforts, but they can quietly affect your sleep, mobility, and overall well-being. The good news is that with thoughtful, consistent care, through hydration, nutrition, purposeful stretching, warmth, and mindful medical attention, you can take meaningful steps to reduce cramps and improve your quality of life. Remember, your body is your lifelong companion. Listening to it, nurturing it, and working gently with its rhythms can bring peace to your muscles and calm to your nights. These simple, everyday habits are not just solutions, they are acts of kindness toward yourself. If you ever feel uncertain or overwhelmed, don't hesitate to reach out to your healthcare providers. Together, you can create a personalized plan that honors your unique needs. May this journey be one of comfort, strength, and renewed ease. Your muscles and your spirit deserve nothing less.